Hi, Care Prevention. Welcome to our foot pathology video. We want to take just a few minutes to examine some of the things that come up with the foot other than the ankle and ankle sprain issue in athletics. And I'd like to start with the bottom of the foot in an area that is pretty common to inflame from overuse and overuse type settings like running, basketball. Sometimes you see this in sports like football, but most of the time you see this in weekend warrior type athletes. Your book even references this. But what we're talking about is a condition called plantar fasciitis, and that is a condition that is painful right here at the base of the heel. And what I'm talking about is a soft tissue that runs the entire span or the plantar surface or the bottom of your foot. And that tissue becomes painful right at the heel, and most people really complain about this hurting in the morning. And that is because we sleep with our foot kind of relaxed, and as it relaxes down, that area, specifically the plantar fascia, tightens up. And then we wake up, and the first thing we do is we put our foot down on the ground and we're stretching some very inflamed and some very tight tissue. And so people will naturally say, well, it hurts more in the morning. And so that kind of indicates a lot to me when I talk to someone about their foot pain. And typically, almost always, they will report morning pain, and it get better throughout the day because they're warming it up and they're using it and they're bearing weight on it. So plantar fasciitis is kind of a difficult thing to deal with in that it is an inflammatory condition that lasts for several weeks, months in many cases, and it's treated with exercise, it's treated with an orthosis, it's treated with tape, it's treated with ice massage, it's treated with golf balls. You can find videos about that on YouTube. But there's a lot of different variations of treatment. But one of the most common things that's overlooked is the fact that we probably either need to rest it or we need to start increasing our volume of training so that our body adapts. And what I mean by that is, earlier I said this is a weekend warrior issue. Well, you know, many people only do things actively 2 or 3 days a week, and so they're basically just making their foot mad at them, and they're never really responding and getting enough stimulus from their training to make adaptations. And so they go out and they do something on the weekend or a couple days a week, and they complain to me and they say, my foot hurts. And I tell them, look, you're going to have to do this more often so that your body actually makes adaptations to transmit a stimulus threshold. The same thing is true with shin splints, and I'll kind of get to those here in just a minute. But plantar fasciitis is a tough problem, and sometimes we find that it's not plantar fasciitis, but it's actually a condition called a heel spur. And this is a development of bone on the heel called an osteophyte. It comes because the foot is actually trying to respond to high stress areas, and it does that with bone formation. Some people are prone to this genetically. This is another tough condition. Again, you're going to rest this, maybe even put it in a boot or make it non-weight bearing. There are people who have actually had surgery for this. I'm not convinced that that's always the best way to go because a lot of times I think you're going to get a kind of a rebound growing of bone there, but some people, that's their only choice. But it is a very painful condition that looks like plantar fasciitis in that it's painful in that same area right here at the heel. And that's where plantar fasciitis hurts, so that's where heel spurs hurt. And we're going to see these people, and typically we're going to have to take them off their foot for just a few days, maybe 7 to 10 days, to get them to respond to any kind of treatment. Next on my list is a Morton's neuroma, and this is a nerve injury. Typically between the 3rd and 4th ray or metatarsal, and that is the plantar nerve. And it becomes irritated for a myriad of reasons, but running is typically number one on the list, or jumping. And then also foot trauma, such as dropping something on the foot or kicking something, can irritate that as well. But we have a kind of a unique pain pattern where pain is distributed down into the toes distally away from that nerve. And so one of the things that I do to check for that is I actually squeeze the foot, and then I will press on that area right there between the third and the fourth. And if they exhibit symptoms again from me doing those two things, then typically I can identify a Morton's neuroma. Now, this is a little more difficult to treat in that exercise, rest, or therapy and rest don't always take care of that. One of the things that I usually have to do for those people is I usually have to send those folks to a doctor and refer them out. Sometimes they'll be injected, sometimes they'll use non-steroidal anti-inflammatory drugs, but there's a lot of different treatment methods, but the biggest one is resting that and getting that nerve to calm down, because they actually complain that their foot is so painful that they can't even walk, and so you have to really calm that down. Usually, again, that's going to go into a walking boot. One of the other things that I wanted to hit was a bunion, and in this chart right behind me, it's kind of small, but you can see it right here, is a diagram of a bunion. And a bunion is basically where that first metatarsal has started to leave the foot, and you can see how it's kind of starting to angle away. And as it does that, the big toe or the great toe starts to angle in. And many times you'll see this where you'll find a person has the great toe completely underneath the second toe. And this is a pretty aggressive version of a hallux valgus or a bunion. And I usually don't see these until a person has such pain in their greater toe that they're not willing to participate in their sport anymore. And if it's that bad, then typically exercise or toe spacers or toe taping is not going to do much good. These people are usually looking at surgery, and so it's a pretty simple fix. It doesn't take a long time to get over. It's 6 to 10 weeks, but still that's a long time in the realm of sports. So many people put this off, and they do this in their off season. But it mostly affects women, and what we know is that shoe wear and proper shoe wear really helps to avoid this condition. The next thing on my list is blisters, and I don't have a diagram of a blister up here, but you all know what a foot blister feels like because you've had one, and they're very painful. And the question always comes up, do I drain that blister, and do I take the skin off that blister? My school of thought is that you may drain it, but you definitely don't want to take that skin off. That skin helps to protect some very sensitive tissue. I want you to think about when you've had a blister and that tissue is torn away. And please reference the video below on blister care. But what I want to do is I want to take that blister and I may drain it, but I would like to refill it with a chemical called zinc oxide. And it's very common, and you can buy it at Walmart. And I will use a syringe to inject that blister with that zinc oxide, and I will try to keep zinc going inside that blister to help dry out that area. Blisters are a unique wound that needs to be dried, but it also needs to be protected. And so if you remove the roof or the hood or that skin that is popped up from that blister, you're going to expose some pretty tender tissue. And you can put a Band-Aid on that, you can put athletic tape on that, but it's still going to hurt, and you know that. Best way to deal with that, building a donut and protecting that. But again, go to that video below. It's about 7 minutes long, and check out Blister Care there. She does a great job on that one. And then the last thing I wanted to kind of cover were ingrown toenails and toe sprains. So we're kind of down here on the toe. And if you've ever had an ingrown toenail, you know that they are very painful, especially once they become infected. And typically they have to be removed. The unique thing is what a toenail does to get ingrown, and typically that's because we cut it too short and we leave a little hook, and that little hook continues to grow, and as it enters the toe it becomes infected, and it becomes painful, and it smells bad, and we just have to know how to get that out. Now you don't always have to go to a physician to get this removed, but it's probably the safest bet. But what they're going to do is they're going to take out half that toenail, and it's going to take a while for it to come back. And so the best treatment on this one is prevention and knowing how to cut your toenails, and good grooming there. And then the last thing I have for you is turf toe. And turf toe is basically either a sprain or a strain or both. And so I'm talking about two different tissues. I'm talking about ligaments or tendons. And look at these tendons as they come across the top of the toe. And basically what we've done is we've kicked or we've stumped or stubbed, whatever terminology you want to use, something, or we have hyperflexed or hyperextended a toe and caused a sprain, strain, or both injury. And there's a great way to tape that that I've used before. I've also kinesiotaped these and had pretty good success. But a turf toe is an injury that really requires a lot of tension, because every time we move athletically, we are moving that toe into a hyperextension or extension state, and then we're having to flex that toe to push off into plantar flexion as well. So it's a very tender injury that has to be taken care of. But typically with tape and stabilization exercises, you can do that pretty effectively. Watch the next video about blister care, and then the final video down below is exercises for the foot and ankle. Talk to you soon.